The Global Child Protection Working Group, the international coordinating body for protecting girls and boys in humanitarian settings, has produced a video series on the minimum standards for child protection in humanitarian action. These minimum standards, also known as the CPMS, were developed through widespread interagency collaboration. They are one of the companions to the Sphere standards. This video examines Standard 13, Unaccompanied and Separated Children. For other installments in the series, please go to the CPWG's website. Standard 13 states, family separation is prevented and responded to, and unaccompanied and separated children are cared for and protected according to their specific needs and their best interests. Note that it has two parts: identification, documentation, tracing and reunification, and alternative care. Sometimes there is confusion about terminology, so we always use the globally agreed definitions. Separated children are those separated from both parents or from their previous legal or customary primary caregiver, but not necessarily from other relatives. Unaccompanied children have been separated from both parents and other relatives and are not being cared for by an adult who, by law or custom, is responsible for doing so. In addition, the principle of best interest of the child should underpin all interventions. You will find all this in the CPMS, which are a practical interagency tool that can be drawn upon quickly.
There's no need to reinvent the wheel. It's easily accessible, easily structured, and I think it's also important that we know and promote the use of training tools that exist in relation to the standards. When it comes to designing, implementing, monitoring, evaluating, we have all the tools at our fingertips.
In addition to the CPMS, we have the Interagency Working Group's guiding principles and its accompanying field handbook, which provide very detailed guidance for programming. Separation can occur to any child in any emergency, whatever its cause or nature. However, family separation can be prevented by preparedness measures both at the agency level and with families and communities.
You need to be prepared. You need to have staff who are trained. You need to have your standard operating procedures in place. Right? You need to already have agreements on contingency plan of what you would do, okay, if these children become separated. A couple of ways in which you can help family so that they don't lose their children during a situation of conflict is to ensure that the family educates their children what to do. How do you keep together? If there is a school, what should the school do? To remind them that if there is any fighting, how they keep their children together, how they work together, how they hold hands, etc. And to tell them about things that could cause separation from their children.
Your preparedness measures should not only address the immediate causes of separation, but also secondary separation or those that are likely to occur at a later stage.
Children can accidentally become separated during flight to safety or during an attack. They may have been entrusted by a parent to someone else. They may also have run away. The best way for you to know the real causes of separation is by asking children. So consult with them if it's possible.
And then using their insights, tailor your response. For example, talk to the agency responsible for transport of refugees if children identify being left behind when buses leave. Despite prevention efforts, there will be some girls and boys who end up being separated or unaccompanied. These children and adolescents are amongst the most vulnerable, likely to face violence, abuse, and exploitation. So it is crucial that you and other humanitarian colleagues act fast.
They can easily forget details of their family, so you have to document that as quickly as possible. When children become separated, they become attached to other adults and other groups. Okay, they could be recruited to fight in armed forces. They could become exploited sexually. The children could become street children. They could be trafficked. So it's important that we quickly identify those children and provide them with the necessary protection.
Sooner we can get messages to family, they can access basic services, the sooner we'll prevent additional separation.
When faced with a separation, our first priority is family tracing. We must avoid any long-term solutions until all tracing efforts have been exhausted. Adoption is not appropriate during emergencies. Where alternative care is needed, it should be in line with internationally agreed guidance. The UN guidelines on alternative care are the key guidance for us all. Rather than build childcare centers, we can enable families to care for additional children. We can help them access extra food and provide ongoing monitoring and support.
It's really important that the need of each specific child is identified and assessed, and a care plan is developed to really document what are the needs of that child and what's in their best interest. There really should be a range of different type of care arrangement available to meet the specific needs of each child. Unfortunately, in many countries, there is an over-reliance on residential care as the solution for any child separated from their family, and the evidence shows that this is really not in the best interests of children's development and well-being. And so there's a real need to be able to provide other type and ideally family-based alternative care.
Siblings should remain together, and where realistic and appropriate, children should be kept within their community of origin. Residential care should be avoided as this increases the likelihood of family separation and can undermine children's well-being. This is particularly important for children under 3.
The children also, if they were referred to a center, they should not stay long at the center, because the best place for a child is to stay with the family.
Wherever separated children are, we need to keep track of them and monitor their well-being.
It's important to understand and enhance the existing and traditional coping mechanisms of communities in finding alternative care solutions for separated children. For example, the informal care provided by a neighbor or kinship care provided by extended family members. What matters is that these children and families continue to be accounted for, stay visible, and receive regular monitoring and support until a durable solution is found in the best interest of the child. Sometimes children separated from their parents end up in the care of relatives. We might say that in principle, this is a family-based care model in line with the international guidelines on alternative care. However, as part of the Syria response, for example, we saw some cases of girls staying with relatives that were pushed into early marriage, while boys were pushed into harmful work just to be able to contribute to the family income. In this case, this is an example of inappropriate alternative care because monitoring and support was not provided to the family and to children.
In order to ensure quality of care, as well as the overall prevention of and response to family separation, coordination and cooperation amongst a broad range of actors are key.
It's really important right from the start and often throughout to set up very quickly efficient coordination mechanisms, to know with whom to talk, with whom to coordinate, and to agree upon very quickly and efficiently who's doing what. We should draw upon our respective organizations' mandates, strengths, and agree upon clear roles. Who's in charge of, for example, child care, family tracing and reunification, in-country, cross-border, alternative care solutions. The list can go on.
It's very important to have coordination in all these humanitarian actors, to harmonize all activities so that there will be no duplication of services and more monitoring purposes also.
To ensure a comprehensive response, we need to be cooperating with colleagues in all humanitarian sectors as well as community groups.
People working in water and sanitation, logistics, or livelihood programs can identify unaccompanied and separated children in their work. On top of that, to prevent separation at the first place means families will need financial support, access to shelter, health, and education services, maybe legal advice or counseling. In short, it's everybody's business to deal with separation, from local to national levels and across all sectors.
The importance of community actors is also extremely key to identify problems, to identify vulnerable children and vulnerable families, to monitor children who have been reunited with their families and ensuring that they're doing well and there's no risk of secondary separation.
Effective coordination during the emergency will have benefits for girls and boys in the long term.
When you phase out, there will be sort of like a dividends for these children, so that you leave stronger structures behind. So you can also help the government to look at the laws, the framework, especially when it's coming to the recovery stage, when government would be doing sector reforms. Then you can start looking at the laws of that country. You can ensure that whatever budgets and resource envelope for recovery is being developed, that child protection is part of that envelope.
For many of us, an emergency is an overwhelming experience where our usual ways of working are challenged.
I have learned that separation of children can be prevented, and in cases where children are separated from their parents or from their primary caregivers, there is a need for the government and for the humanitarians to act fast in order the child can be protected from further harm. And quality service must be provided also to the child. And there is also a need for the different humanitarian actors to complement with the services for the welfare and for the benefits of all the children affected.
Other installments in this series focus on how to use the CPMS and on the specific standards for addressing needs. The CPWG provides support for applying the standards, such as mainstreaming briefs, guidance on contextual adaptation, and training packages. For more information, please go to cpwg.net/minimum-standards.